Good morning, everyone. We will give it just one more minute before we get started. Thanks for joining. Okay, well, I know folks are still joining, but I would like to say good morning and welcome to everyone. Thanks for joining us today. My name is Mandi Kimball, and I'm the Vice President of Children at Risk and Director of Public Policy and Government Affairs. And we are truly excited to have this conversation today. I'm not sure if many people were able to get a lot of rest last night. So hopefully you have your cup of coffee or tea, whatever you need to get through, but I don't think that you're going to need it for the next hour and a half with our lively conversation. We are truly honored to have some great panelists with us today talking about what do the elections mean for Texas children and how can we best advocate for children and families for the upcoming legislative session. And so before we get started, would like to introduce Children at Risk and our co-sponsors. If you're not familiar with Children at Risk, we are a statewide research and advocacy organization that advocates for the whole child, from parenting to early education, public education, physical and mental health, human trafficking, and really digging into the data and looking at what is going on in Texas, what are the gaps, and how can we really move the needle in regards to local, state, and federal policies to improve the lives of children. Today, as a co-sponsor, we also have the Texas Family Leadership Council that has been created over the past year, which is a wonderful, strong coalition across the state from service providers, from key stakeholders, and key advocates from every corner of the state, really focused in on children and families and how can we have a united voice and truly prioritize what's important to us, which is children and families. And then we also have ACTS, the Advocates for the Children of Texas, which is a young professionals group that is energized and has really had lots of movements engaging the business community and young professionals, bringing them into advocacy conversations and making sure that children and families are represented. So we're going to have a wonderful conversation. Thank you for joining us. And I'd like to hand it over to Dr. Bob Sanborn, who's the president and CEO of Children at Risk.
All right. Hey, Mandi, I wanted to ask you as we get going, did everything turn out last night that you expected to turn out? I mean, was it as you expected?
You know, I think there were some surprises, particularly in Texas, but what I am really energized about are all the people that went out to vote and that people were passionate and ensured that their voices were heard. And so I really look forward to working with those voters and with the public officials that have been elected to make progress in Texas.
Did you sleep much last night, Mandi? I'm wondering.
I did not, but that's okay.
I know, right? Yeah. So it's always exciting, right? No matter which way it turns out, though some ways, sometimes we're more excited than other times, but it was good overall. Thanks, Mandi, very much. And Mandi is one of the stars of our legislative work. And so she works on behalf of Texas Family Leadership Council, Children at Risk, and doing a lot of our legislative work. But let me introduce our opening panel today. Bob Garrett is with us. He's the Austin Bureau Chief for the Dallas Morning News. Bob, how are you doing this morning?
Let me get myself unmuted, Bob. Doing great.
Very good. Nice to have you here. Jason Sabo, who's with Frontera Strategies and is a longtime participant in the legislative process. Jason, you didn't sleep at all. Is that correct?
I slept a little bit. I did sleep, not well, but I did sleep a little bit.
Very good. And then our good buddy, Deb Zuloaga. She's the president and CEO, United Way of El Paso. How you doing, Deb?
Good morning. I'm like everybody else, a little sleep deprived, but doing well. Thank you.
Excellent. Very good. Hey, Bob, you're the sage on this stuff. So I wanted to start with you. And when you look at the overall picture, the big election picture, did it represent, I heard some people say this is the end of democracy with all the voter suppression and so forth, or was it sort of a rebirth with the big turnout that we had in Texas? What was your view of the whole thing?
Well, we did have a bigger turnout. It was fiercely contested on both sides. A lot of people got engaged. I just say we've been hearing a lot in Texas in recent years that we're not a red state, we're a non-voting state. And I think we got above 11 million votes in a presidential election. It's still not great, but a better turnout there. I think the claim that we're not a red state is on thinner ice this morning than it was yesterday, because while you can say that the Republican domination of the state is slowly decreasing, and I think that that's evident. Trump carried it by 9 points instead of 6 points instead of 9 points last time. Biden got 1.2 million votes more than Beto O'Rourke did 2 years ago. But I think, there's a couple of things, and the Democrats held on importantly to the 2018 gains they made in the US House seats and Texas House seats. But yeah, there's two other things to say, Bob.
Yeah.
One is next year's redistricting. This was a huge opportunity for the Democrats, and it has slipped through their hands, and the Republicans can draw the maps to their own advantage for at least another half decade, probably, at least making it very difficult for Texas Democrats in the legislative and US House arena. And then the other thing is just against expectations, even though you can stand back and say, there's some things here for Democrats to celebrate, the expectations were sky high. So I think in that way, it was a devastating defeat for Texas Democrats.
Yeah, I agree with you, Bob. Jason, yesterday and many weeks before, you have been predicting, and you don't predict, right? Because you're sort of like, I am very political, but nonpartisan. But yesterday you were predicting that the Texas House would go Democratic. Obviously, that's not happening. It's not even close. What does this mean for families and agencies serving children and all of the Texans that are out there that are looking to our state legislature for leadership? What does this mean this time? And you and I have talked about this before. Republicans care about families just as much as Democrats, in just different ways. And so what does this mean for our families and children in Texas?
I think, well, folks first off have to remember that what happened yesterday, to Bob's point, was essentially everything stayed the same. So ultimately, you can make the argument that from an advocacy perspective, if you like what the legislature did in 2019, the last time the legislature met, we numerically might be seeing more of the same. But I also think Bob's point about the solidifying of the Republican majority is very important and very clear. And I think that when you look historically at redistricting, in many ways, you could make the argument that other than Dan Patrick and Greg Abbott, the biggest winners yesterday were Joe Strauss, David Dewhurst, and Rick Perry, the three people most primarily responsible for drawing the map that ultimately held up to its greatest test yesterday. So when you think about how important this redistricting round is for the next decade, you have to remember that last night's results were part of a die that was cast, as far back as 2011. Yeah. So, and the maps worked. We saw them kind of push to their threshold in 2018, but when it came to 2020, the design of the design of the machine withheld the stress, you could argue.
We saw people like Sarah Davis, who's a Republican, who, even with the switch of the House, people thought that Sarah Davis may survive, but Ann Johnson ended up winning that race. What does that majority of Republicans, and what does the defeat of people like Sarah Davis, what does that portend for us?
I think from my perspective, what we're going to see is in many ways a return to the Joe Strauss model of leadership. If for no other reason than if you think, Bob could speak better. I'm a Pleistocene era dinosaur. I'm not sure where Bob is. I'm not sure if Pennsylvanian is before or after that, what kind of dinosaur he would be. But I think of this as like a moment like 2000. The last time we've had these kinds of partisan flips, the speaker's race is often determined very quickly. The fact that we're all having this conversation right now without having 100% sure knowledge of who the next speaker is means that things are a little more fluid than they might otherwise have been.
I will make sure to ask Bob about the speaker race. I want to get to Deb. Deb, you represent in many ways West Texas and border communities. You're out in El Paso. So the first question for you is, what does it mean for communities like El Paso? What is this election? And obviously this is a first glance. We haven't had a lot of time to analyze, but at first glance, what are you seeing?
I'm going to kind of agree a little bit with Jason. I think we're going to see the status quo. In El Paso, we elected overwhelmingly a number of Democrats, including a new state senator, Cesar Blanco, for a retiring senator. I think it's going to be the same thing that we've seen. I think you're going to see this faction or these Democrats continue to struggle a little bit to get the agenda pushed. But I think ultimately, I think for El Paso, for us, it continues to be and will continue to be disparity. And whether that is, which has just been exacerbated by the pandemic. And it's everything from economic disparity to education, health care. We're certainly, it's no big secret where we are in our COVID numbers right now. It's going to be interesting to see how our delegation, how they figure out how they thread the needle to be able to figure out how to benefit our community. But also, I think again, and I know Jason can speak to this and Bob can speak to this better than I can. We can't also look away from the fact that, we've got some serious financial budgets at the state level. So, we can all wish, and we can certainly, even if the House had flipped, you can't increase dollars magically.
Yeah. Deb, I also wanted to ask you yesterday, as Joe Biden didn't do as well in Miami-Dade, right? And they kept saying, well, Latinos tend to be voting for President Trump. And then they started equating that all across the country. And we did see in the Rio Grande Valley, we saw a little bit higher Latino vote for President Trump. But talk about that. What's the reality with Latinos and voting for the president?
And that is something that's so interesting. And I don't understand why, in a previous life, I had a political background. This is conversations that have been had within parties since, as long as I was my first presidential campaign in 1984. This idea that both parties continue to analyze Latinos, Hispanic, whatever you want to call it, as a homogenous group, just it baffles me. And I don't understand. And I think as long as both parties continue to do that, I think you're going to see, you're going to get a sense of one party taking the group for the different groups or the different ethnic or background or nations of origin for granted. And you're going to see a complete miscount of people and why they're voting. Obviously, Cubans and Venezuelans have very, 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 very at their core. And, Bob, you and I had this conversation. At the core of who they are, beyond anything, is you say the word socialism, and that's it. You're done.
Right.
And I think that is really a mistake, not for either party to really begin to acknowledge the differences and to target and communicate a message that targets the importance and the values of the Republican Party for many of these voters, and they're just not doing it.
Yeah, and I think sometimes the difference between a South Florida Cubano and a Latino from the Valley is as different as a River Oaks Republican and a Tyler, Texas Republican, right?
Exactly. And also, you know, the other thing is, and I think this is, again, going back to, again, that Jason and Bob can speak to, you know, you also have to recognize that like everything else and like every other ethnic group, it also has to do with socioeconomic. It has to do with levels of wealth and you know, that you can't just view it as just its ethnicity.
Right. Very good. Hey, Bob, let's get to Jason's point about the speaker. What do you see happening in the state of Texas, not only in terms of who, but in terms of what that means for family and children? And we saw the last time when we saw the 12 seats that switched in the state legislature from the North Texas area, we saw a significant moderation on the part of the House, right? They were more willing to talk about things that they hadn't talked about before. What does this mean for us now with the speaker and with sort of the level of accomplishment that may come out of our state house?
That is a really good question. 2 years ago, you know, Beto O'Rourke and picking up a dozen seats in the House, Beto O'Rourke coming within 3 percentage points of Ted Cruz. That got the attention of our ruling Republicans in a way that I think you aptly described, that we did not see a bathroom bill in the 2019 session. They did the school finance and property tax. They got down to, you know, family kitchen table issues and trumpeted that they were heeding their suburban voters. And I think, you know, John Cornyn as well as President Trump did better in these suburban counties around Dallas, Houston, Austin, San Antonio than Democrats did in 2018. I think it's way too early to forecast the speaker's race, or but I mean, there are some for your particular group of people interested in children and families. You know, I mean, the big picture is the budget and healthcare. I mean, if the Democrats had taken the Texas House, we would have probably seen some fairly aggressive oversight hearings on how Greg Abbott has handled the COVID pandemic. That is not going to happen. Greg Abbott does face challenges from his right about overreach during the pandemic, but his governance job just got a lot easier after last night. Are you having trouble hearing me? I'm getting a little warning sign there. Okay. The budget is not good, and we still have a party of low taxes, low regulation, and no income tax. So how you get more money to come from the skies, it's a real mystery. I think people advocates had really hoped that House Democrats could really make cases for things like Medicaid expansion and closing certain loopholes and doing stuff that would put more money on the table. All of that is not clear at all. I think, you know, the parental rights groups will still have a seat at the table. There was a Houston state rep race. Lacey Hull will succeed Dwayne Bohack, and she is part of a parental rights group. I think, you know, on foster care privatization and a tight budget, I'm not sure there's going to be a halt to privatization. I'm not sure there's going to be adequate funding of privatization. Because of the budget squeeze, the doormat to social services that we saw budget cuts proposed for eligibility determination. I don't know whether those go forward or not. You know, all of the concerns about 12 months continuous eligibility for Medicaid kids and fewer asset and income checks. I'm not sure what happens, but those goals are less clear without a Democratic controlled House, that they will be achieved. So it's we've got, you know, criminal justice reform was in vogue with Republicans, but after 2020 and the demonstrations in the street and the Back the Blue, that our big three leaders did a lot of press conferences around the state, if you didn't notice, about backing the blue. I'm not sure how that all turns out. So there's a lot of questions, and we could talk, I guess, about healthcare would be a good one to talk to at some point, because there's a lot of different scenarios here depending on who controls the White House.
Yeah. Hey, Jason, sticking a little bit with this Medicaid expansion, Medicaid expansion. when we look, Sarah Davis was one of the Republican leaders. She's gone. I don't know that there's a Republican now in the House who's going to sort of take up that banner in terms of calling for it. So you hear from Bob, right? This idea that maybe it has empowered the Republican, the conservative side of our House, but at the same time, the warnings are there, right? Things are changing. Things have changed. Maybe it didn't go completely blue, but we're certainly bluer in terms of the votes. What is that going to mean for this legislative session?
Well, for this legislative session, I want to focus on the green, because I looked this morning before we got on, and West Texas Intermediate was trading at about $35 a barrel, which, if you understand how the Texas budget works, is a big deal in Austin and a big deal in how they do their projections. I am one of those people who is looking at next session thinking that this is a moment of like really fundamental choices. Last session, before the pandemic, the legislature in some senses wrote itself a bit of a hot check with the school finance reform, knowing that they were going to have to come back this session and backfill whatever hole was created then. And then COVID hits. So they're, to a certain degree, on the hook to themselves, understanding that House Bill 3, the public school finance reform, was very popular with members and with voters. So we hear consistently in conversations with Democrats and Republicans, protect House Bill 3, which is very important in terms of school funding and full day pre-K, et cetera. But at the same time, this morning, there were 3,100 new cases reported of COVID-19 in El Paso, 29 new deaths just in El Paso, So we have these two issues that are coming into political and cultural and social confluence right now of a budget crunch that's requiring a significant investment in public education with the implosion of our healthcare system and our public health infrastructure because of the stress of the pandemic. Medicaid expansion is no longer a luxury or a choice. It is a necessity. It is a necessity to do continuous coverage to 12 months for children. Is it a necessity to provide 12 months of postpartum coverage for new moms? Remember, the legislative session starts in 2 months. If a mom has a baby today, her postpartum coverage will be over before the session even starts.
Do you think that the state legislature now will think it's a necessity?
I think that the budget, when we really begin to talk about what the numbers really look like, we can only rainy day fund our way so much out of this. We were hoping for a windfall of federal money, which to Bob's point, may or may not be materializing based upon what happens in the next few days.
Deb, let's stick with health. I mean, obviously El Paso is really suffering right now. Do we see, I mean, do you feel in El Paso that our state legislature in Austin is going to be paying attention to El Paso, to the Valley, and to some of these places that they consider to be pretty blue? Or are they going to be paying more attention to, and we don't know who will be president, but if it's Trump, are they going to be paying more attention to that and to the governor? I think it's likely that the president will be Biden as we look at the numbers right now. But this whole health thing, what is this going to mean?
I think that it's I don't think we have a true crystal ball to be able to see that. But, I think we have a couple of senior House members. But as I just mentioned, we have a new state senator who's, going to be the most junior person, one of the most junior senators in the Senate. So that's going to be a challenge. I think a lot, I do think, and to Bob and Jason's point, I do think a lot's going to have to do, will have an impact on who wins the presidency. And as you said, I think obviously if Senator Biden wins, it will look a lot different. If President Trump wins re-election, I think, again, those are going to be two big factors that determine, what happens in the Valley and in El Paso. But at the core, I also think that you cannot ignore from a health perspective what's happening here in El Paso. No matter what you do, no matter you can shield your eyes, but you can't take away from the fact that we are absolutely at a very, very scary point with COVID-19 out here in West Texas. It just is.
Yeah. Bob, can you follow up on some of these health ideas that you were talking about? Where do we think we'll go with health?
Well, as you know, we heard a lot in Judge Amy Coney Barrett's confirmation hearings about this upcoming hearing on the Ken Paxton-led suit challenging the Affordable Care Act. Most legal scholars do not think that that is going to succeed, but that is, front and center. Once we get past that, we may still be litigating the presidential election, but there's obviously two big different scenarios. One is a Biden White House negotiating with a Mitch McConnell-led Senate and Nancy Pelosi's House on some kind of fix of Obamacare and a CARES Act thing that would deal with, a lot of people who've lost their employer-provided insurance. So that's one scenario. The other is a Trump stays for a second term, and we've now, I think, seen a lot of Republicans in our state leadership, from Paul Betancourt in Houston to Lyle Larson in San Antonio, talking about Medicaid expansion just because of what Jason was talking about. The budget is so bad. It, I think, would be easier for these Republicans in Texas to do it with a Trump administration that would give them a waiver they would, designed in a way that they would love, and they could beat their chests and say it's personal responsibility and give us the money, please, and add 1 million or however many adults you would get on Medicaid. That doesn't even deal with what Deborah is talking about, this pandemic, the devastation of people who now are newly uninsured. We did hear, though, a lot in this from John Cornyn down to Texas House Republican candidates, a lot about we do want to do something about pre-existing conditions. Of course, the bill they've pointed to that they passed in 2019 is not very credible at doing much on that, but it is, as Senator Kelly Hancock told me a week or so ago, it is a placeholder saying we will do something if Affordable Care Act is wiped out. So they know that pre-existing condition exclusions are a vulnerability. The Republicans do. They just, I don't think, have a comprehensive solution because, as you know, you can ban the barring of that. That doesn't mean people are buying insurance that covers their pre-existing condition. It's a big series of steps from a prohibition to an actual provision of affordable health insurance.
Bob, let me ask you another question. I want all of you to answer this question around voter turnout. We had tremendous voter turnout, certainly early voter turnout in Texas. But when you're a new voter, you want immediate satisfaction. And if a lot of people turned out to vote and they didn't get what they wanted, will they come back to vote? Additionally, will this now Republican-controlled government that we have, will it make it a little bit more difficult for all these people that wanted to vote early? What do you think, Bob, will happen in terms of voter turnout in the future as we look at what just happened?
Well, and I noticed we had a question in the Q&A about seniors versus young people in terms of who will benefit from this election. I think you've put your finger on a very important question of first-time young voters. Are they going to be so disillusioned? It's hard to imagine, Joe Biden negotiating with his old negotiating partner, Mitch McConnell, and delivering stuff that's going to excite the 18 to 39-year-old cohort as far as college loan debt, as far as, Medicare for all and environmental policy. I mean, it's President Biden now faces a very tough challenge to deliver, on the coronavirus. He's got to deliver on. And so obviously there's a room for a bipartisan deal there. But I think it's a tough question of how first-time voters are going to view all this come 2024.
Yeah. Jason, your thoughts on this and any final thoughts?
One specifically on the voter turnout, I do think that there is a generational shift here. And when you look at what happened around the Democratic ticket, the enthusiasm was at the end there with the VP nominee, with Kamala Harris, potentially the next vice president. There's something to be said there. And I think that there is this generational transformation that's happening, and it's happening fastest in places like Texas. And just to Deb's earlier point, that folks on both sides can't take the youth vote for granted, because those votes are up for grabs for Democrats and Republicans, not one party or the other, as we saw last night.
Yeah. Deb, your thoughts on this? Are people going to come back and vote? Are they disillusioned?
No, I do think they're going to come back and vote. I mean, but again, I think it's up to both parties to make their case. And I think this is where I think both parties make such a huge mistake. They are not, they're not continuing to create messaging and create engagement efforts targeted at the critical, and and again, I will say, I mean, I think they both tend to write off groups so easily as, oh, that's that party or that. And I think that's, a big mistake. So I think it's incumbent on both parties to keep those young people engaged. I mean, it's up to the parties to really make the case of why they need to be engaged with the party and the issues. And, that's going to be on them.
Yeah. Bob, our final question of the day. You see the data. You're a seasoned political reporter. You're in contact with lots of people. When we look at the data nationally right now as we speak, you see Biden pulling this out, or you see the president pulling it out?
I don't have enough data to answer that. I mean, I do think it's obvious Biden has learned the lessons of Al Gore in 2000, getting out there last night, not conceding, saying we look good. Of course, President Trump answered a few hours later. So I think Arizona obviously was a pickup. It's very close in everything I've seen about Michigan, Wisconsin. I heard, former Governor Ed Rendell of Pennsylvania last night claiming Pennsylvania, once they count all the ballots, is going to be Biden territory. It really does look like a several week long cliffhanger here, Bob. I don't have the answer.
Yeah. Very good. Well, none of us have the answer, but we have a lot of wishful thinking. I know that. So Bob Garrett, Austin Bureau Chief for the Dallas Morning News, one of our favorite newspapers. Thank you, Bob, for being here today. Jason Sabo, our favorite lobbyist in Austin. Thanks, Jason. Deb Zuloaga, who is over at United Way in El Paso. Thanks, Deb, very much for all that you do. And thanks for being here today.
Thank you.
It was great to hear from all three of you. Let's transition over to Mandi. Mandi, I know that you're going to help us out a little bit, and we're going to talk a little bit about this next upcoming legislative session and what it means for Texas children and families. And do you promise this is going to be interesting, Mandi? No, you're on mute. It's not interesting if you're on mute.
I know. Okay. Yes. No one is going to fall asleep, and you don't need your extra cup of coffee because I'm going to talk fast. And this truly is an opportunity to look at how can we unite our voices and advocate for children and families for the upcoming session. As I mentioned, this is a focus from Children at Risk and the Texas Family Leadership Council, pulling priorities together, which really cover the gamut. And so I'm going to move quickly, but I encourage anyone that has any questions or would like more detailed information about some of the data that I'm about to share or the policy recommendations, I'm happy to engage. If I can move the slide. There we go. All right, so let's start off with early childhood education. So early childhood education, particularly childcare, has recently captured the attention of many during the COVID pandemic, from parents trying to figure out how they were going to go to work when the schools weren't open, businesses trying to figure out how can they get their employees in, and public officials as well, trying to figure out what can be done during the pandemic. Childcare has a direct and indirect impact on the Texas economy. Women with children under the age of 5 are less likely to participate in the workforce, and data shows during COVID that women were more likely to leave the workforce because of childcare needs. And so we must understand that expanding access to reliable, affordable, quality childcare supports workers, supports business, and boosts the Texas economy. So when we look at investments in Texas childcare, Low-income working families are eligible for child care subsidies, which is funded by the federal government. And in 2018, Texas received $747 million in a block grant that was administered by the Texas Workforce Commission. And they took those dollars and distributed it to 28 local workforce boards, which then provided funding to roughly 8,000 childcare providers to help with low-income working families' tuition. And this served more than 136,000 low-income children, and that's a lot. However, only 10% of eligible children participated in the program because of limited funds. And when we look at childcare in Texas, we have over 17,000 childcare providers when you look at centers and homes. And a little less than half of the childcare providers participate in the subsidy program. And what's interesting is from that population, only 20%, a little over 1,000 or a little over 1,500 childcare providers are participating in Texas Rising Star. Texas realized years ago that childcare was more than just babysitting, that quality mattered for a child's development and also for academic success. And thus we have the Texas Rising Star, which reimburses at higher rates based on quality and really is looking at accountability. There we go. And so policy recommendations that we are pushing is one, to require subsidy providers to participate in Texas Rising Star. This is extremely important when we look at accountability and how our government dollars being allocated, and it also increases access to quality childcare. We also need a cost of quality study when we're looking at reimbursement rates, when we're looking at the childcare industry. It is unclear of the business model and how much it costs to run a quality childcare business. We also want to build upon what happened last year around HB3 and full day pre-K, really strengthening public-private partnerships, gathering the data to make sure that we strengthen the early childhood education system, and so that we're not working in silos and that real strategies can be implemented to make sure that children, eligible children, have access to quality care. We also need to focus on the educators' workforce. We need to develop a statewide plan and goals and really a strategic plan on how can we strengthen the early childhood education workforce with credentials and living wages. We also need local flexibility for contracted slots, allowing local communities to prioritize and reserve seats for vulnerable children, particularly infants and toddlers. And then we also need to increase reimbursement rates. If you're interested, you can go to Children at Risk website. We have data for your local community. It's an interactive website, and then also information on early childhood education for legislative districts. All right, so let's talk about public education. We know that children do best when they're in school and when they're engaged and have quality teachers. And chronic absenteeism negatively impacts a student's ability to learn and also decreases the likelihood that a student is going to graduate on time. The Every Student Succeeds Act defines chronic absenteeism as a student missing 10% or more of school days. And currently, Texas does not have a definition around chronic absenteeism. If we were at the Capitol today in an education hearing asking how many kids are chronically absent, there would not be an answer. We don't have a definition, and the information is not being collected. So Children at Risk did a public information request. We created a methodology and crunched numbers to try to get an idea of really what is going on in Texas. And as you can see, 12.5% is the state average for chronic absenteeism, and Black students followed by white students have the highest absenteeism rates. We went a little bit farther. Sorry, my thing keeps clicking. There we go. We dug a little bit further and more into demographic indicators. So you see the statewide average. And if you look, it's showing that chronic absenteeism rates are higher in low performing campuses, are higher in campuses that have high average student teacher ratios, have higher rates in schools that have a high economic population, in campuses. And then on the reverse, when we look at the lower rates are at those high performing campuses, the gold ribbon campuses, which are high performing, high poverty schools that are really moving the needle, and those campuses also that have lower student teacher ratios. So the makeup of the classrooms are very important. When we look at grades, 12th grade, 9th grade, 11th grade have the highest chronic absenteeism rates. So it's important that we identify where this is happening and truly intervene and fund the initiatives to prevent chronic absenteeism. So our policy recommendations is one, to define chronic absenteeism so that we can have a name and address the situation, and to add chronic absenteeism under the at-risk category in statute. And this is important so that we can provide supports and incentives to schools so that they can intervene and address the situation. And then of course, we need to ensure reporting, making sure that we have the data so that strategies can be developed and implemented so all children can be successful. Texas has also for decades been talking about a digital divide. It has been around. Again, during the pandemic, we have clearly seen that too many children lack access to the internet and are unable to learn virtually, which has been the situation and still is for many. So we have several different maps. This is just an example here, but the purple is poverty. And so the darkest purple is the highest poverty. The dashed lines are the lowest levels of access to internet. And then the yellow points are low performing schools. So it's clear that our most vulnerable students are the ones that are really being challenged right now. Not that they already weren't, but don't have access to what they need to fulfill education needs. So recommendations are focused on collecting that data and really identifying the gaps in learning and pouring resources into those most needed areas. Also to expand access to broadband and technology so that all students have the tools they need to learn. This was mentioned earlier before. The Texas legislature is going to be in a difficult situation in regards to the budget. We clearly have a shortfall. The legislature is going to have to figure out how are they going to continue to financially support the education reforms from HB3. They're also going to have to figure out how can they financially support schools with COVID-related issues and supports. So it's paramount that public education funding is protected and not cut. This is not the time. We made some great progress last session around full day pre-K and early learning academies and allowing low performing elementary schools to be able to have a longer year to reduce that achievement gap. And we must send a clear message that schools need to be appropriately funded and that public education funding cuts cannot happen. When we look at the health and well-being of our children, 1 in 5 uninsured children in the US are from Texas. Texas has the highest rate of uninsured children and the highest number of uninsured children. And we know children who have health coverage are right now overall healthier. As adults, they're healthier. They have a lower chance of dropping out and they have a higher chance of a higher income in the future. Health coverage is important. And we know that healthy moms help with healthy babies. Healthy moms and moms are extremely important to a child's brain development, emotional development, and they serve as the primary giver. And when we look at Texas in regards to maternal health, we're struggling. Texas is struggling with high maternal morbidity and mortality rates. Texas has chosen to cover a woman who is uninsured during her pregnancy. However, 60 days after giving birth, her health coverage is gone. And when we look at postpartum depression, which was mentioned earlier, it usually doesn't start at least until 4 to 6 weeks after delivery, after a mother's health coverage has been dropped, which results in women not being diagnosed and not being able to receive the health services that are needed. And so 2 main priorities in regards to health is expanding Medicaid, making sure that we extend 12-month health coverage for mothers postpartum, making sure that children have 12 months continuous Medicaid coverage. Right now, they might have 12 months, but it's only 6 months continuous. And then every month there is an income check. This is too much bureaucracy and children are falling through the cracks. Okay, so everyone's favorite subject, recess, right? You ask a kid, how was your day? What was your favorite part? Recess, because it's extremely important. Unfortunately, Texas does not require recess in elementary schools. And it's more than just having fun. If you look at the brain activity in this diagram, you have one brain of a child who is sitting there quietly, and then of another child after 20 minutes of walking. The brain is alert and ready to learn. And just like adults, children do better after they have a moment, after they take a break, after they move around. And we need to make sure that children are really able to do this so that they can learn better. Recess is correlated with academic success. So we dug into school data, and what we found was high-performing districts had were more likely to have recess policies compared to low-performing districts who didn't have policies. And so our request to the Texas legislature is to require school districts to have a policy. We're allowing local flexibility, but that this is really important to their health and education. So looking at equity and racial disparities in Texas. Texas is faced with harsh realities. Infant mortality rates for Black babies is 2 times higher than those of white and Hispanic babies. Texas is home to 4 cities that lead the nation in education gaps when we're looking at white students compared to students of color. And although African Americans make roughly 13% of the US population, they're accounted for 60% of the COVID-19 related deaths. We know that state agencies and state laws and the state legislature have an impact on the prevalence of racial disparities and equity. And right now, there's no formal process within a state agency or within the state legislature to really have a meaningful discussion about what is the impact of these rules and laws that we're talking about. How can we move the needle and decrease the racial disparities and make our policies, laws more equitable for all of our children and families? And so a policy recommendation that we're pushing forward is to have the Sunset Advisory Commission be required to look at strategies that are within the agency to reduce racial disparities. At the same time, allowing the Lieutenant Governor and the Speaker of the House to request, which would require a child racial disparity impact statement, so that when laws are being discussed on the floor of the House or in the Senate, that there can be a pause for a meaningful conversation. What is the outcome? What is the impact and the consequences? Is this really addressing the needs of our children and families? And the last issue is going to talk about is human trafficking. Texas is a hub in the nation for human trafficking. We also have the most anti-human trafficking laws, which is great, but we need to do much, much more. So there's 3 elements of human trafficking: force, fraud, and coercion. And traffickers use tactics to lure and make false promises to their victims around love and money, protection, transportation. And then they use tactics like fear and threats to make sure that they maintain and assert control of their victims. Here on this slide, the lines are representing calls to the National Human Trafficking Hotline. And the red line is for sex trafficking, the blue line is for labor trafficking. And although there are not robust studies that are looking at or that can prove the entrance into human trafficking, this chart shows when victims are calling and reaching out for help. And as you can see, it can start as early as 8 and 9 and 11. But the peak is for the 15 and 17-year-olds for sex trafficking that are reaching out. So we do have a labor trafficking. This is a horrific crime and unacceptable, but our American children are being trafficked at rates that are just unbelievable and must be addressed. So where does sex trafficking happen? Storefront stores and human trafficking go side by side here in many different cases. We have 800 to 900 illicit businesses looking at the hair salons and the nail salons. There's illicit cantinas. There's strip clubs where managers are running huge circuits, trafficking and moving women and girls from place to place. There is some street prostitution, but the majority of it is happening online and virtual services where the buyers feel safe, it's easily accessible, they're not having to drive around in a corner, they can click a button and someone can be delivered within minutes. So here's a dashboard. Knowing that human trafficking is so widespread on the internet, we've been digging into websites. And here is a list within 6 major areas in Texas for the last 18 months. There have been 1.6 million ads posted for sex trafficking. And as long as there's a demand, there's going to be a supply. And people aren't posting these ads because they want to pay the fee and just see if anyone bites. It's because people are there demanding it. And we're looking at the activity and the rest, and we have a serious problem and more protections need to be put in place, particularly for our vulnerable youth, our foster care youth, our CPS youth. Residential treatment centers have become recruiting grounds for traffickers to pick up these vulnerable youth. So policies need to be in place to protect them. We need to increase buyer penalties to end demand. And we also need to allow legitimate businesses to get out of their lease. We have strip malls where there's illicit businesses that are happening, human trafficking, and the good people want to be out. We also need more training and awareness at hotels so that employees can identify the trafficking that's going on. And then lastly, to mandate registration for all white label ATMs. A lot of people are like, ATMs and human trafficking. ATMs right now for the private businesses are really helping to fuel this industry. There's no record of it, and money laundering is happening as well. And so these are some of the steps that we're working with the Attorney General's office and other advocates to address these issues. So that was a lot. And very quickly, and if you have any questions on all of them or any particular issues, please feel free to reach out.
Mandi, one last question as we wrap up this part. When you look at the entirety of this agenda for children and families, what is your biggest worry knowing what our legislature is going to look like this coming session after the elections yesterday? What's your biggest concern going into the session? What's your biggest hope? All in 1 minute, by the way. Yeah, well, my biggest concern is the budget. And
and I know that we talked about election results. We've had meaningful conversations with all public officials about these issues. I think that they do care. Yes, we need to do more, but I'm afraid that the budget is going to hinder some of these activities. And as advocates, though, we must push and say now is not the time to cut. It's not the time to cut healthcare. It's not the time to cut public education. And in fact, we need more. And also, a lot of these policy recommendations that I mentioned were cost neutral. There's opportunities for good policy to make the right steps for our kids so that they can be successful.
Very good. And obviously, we want as many people engaged as possible. And people can reach out to you, Mandi. People can reach out to the Texas Family Leadership Council, because the idea is to have a lot of people part of this. Mandi Kimball, thank you very much,
Thank you.
Mandi. Great work that you do each and every legislative session and every day at Children at Risk. So thank you so much. Let's go to our next panel. We're going to talk about community and business engagement. Let's bring on our panelist, Susan Hoff from the United Way of Metropolitan Dallas. She's the Chief Impact and Strategy Officer. She's also one of the co-chairs of the Texas Family Leadership Council. My good buddy, Michael Kelly, he's the Vice President of Programs at the Paso del Norte Health Foundation in El Paso. And then, of course, our good friend, Chris Wallace, President and CEO of the North Texas Commission. Welcome, Chris. Welcome, Michael. Welcome, Susan. Thank you all for being here. I know that all of you, except for Michael, stayed up late. Michael is the smart one in the group, and he's like, yeah, this isn't going to make a difference. So let's start. Susan, United Way, you guys work with nonprofits, businesses all across the community. How will the election in Texas, right? How will the election in Texas have an impact on the work that you guys are doing and the work of nonprofits in our state?
You know, good question, Bob. So, a couple of things. One, I wanted to start with a couple of bright spots. We're talking big election like national and statewide, but just a couple of things, observations just in Dallas and San Antonio both. We had some really significant school bond elections pass. Dallas, a $3.5 billion school bond, which is significant for Dallas. I think 2 out of 5 propositions passed, so the bulk of them. San Antonio also passed a continuation of funding pre-K for San Antonio with continued resources there. And so, kind of the point there is the question you ask is, how does this impact nonprofits, but also our connection with businesses is, I think, key to both of these initiatives is that they had significant business backing. If you think about chambers or citizens councils, corporate leaders backing these local, very significant initiatives, and as well as philanthropic support as well. So again, I think you're seeing some interesting moves, which is not new, but I think it's increasing in terms of the corporate community engaged in local, but I would say also national and statewide elections and governance as well. I think some of the signals that we're seeing, if you think about just over the last really 5 or 6 months, the amount of capital investment that we're seeing on the corporate side, particularly in equity work, which of course affects children and families. But think about Kellogg Foundation, Ford Foundation, banks, all making really, really big investments in driving systemic change, which, again, that may not be exactly in the realm of policy, but it certainly drives policy, particularly when corporate leaders put their money and their focus into this work. So, that's where I'm seeing, I think it's very hopeful is what I would say when you see leaders like that investing in work where I would say addressing systemic racism and not only putting money quietly into it, but saying very openly and very loudly, this is a focus area for us. I think that by that drives policy as well as actually policymakers driving policy.
I think it's interesting, Susan, that you start off with these referendums or these ballot initiatives in Dallas and San Antonio, because in a sense, we saw such tremendous voter turnout in our large urban areas.
Mm-hmm.
You get a sense that if our state isn't going to make some of these changes, you're going to see at least ballot initiatives in urban areas where they feel like, hey, let's take care of ourselves. And we've seen that a little bit, but those two big ones, and we may see a lot more, right? Because there's so much potential for ballot initiatives actually that appeal to everyone, not just to some sort of core groups. Michael Kelly, you're out in El Paso, the Paso del Norte Foundation. And in the world, we've seen more foundations begin to support this idea of systems change, advocacy. Let's sort of look at this from the top level. How do you think this election will have an impact on that continuing effort to support systems change from the philanthropic side?
Yeah. Well, thank you, Bob and Children at Risk, for having me here this morning. As I kind of approach your question on systems change, and I've been with this foundation 21 years now, and sometimes foundations I know can seem kind of behind a curtain a little bit. So first of all, I'd just like to say I do think philanthropy has a role here. You're going to hear sometimes philanthropy doesn't have a role, that we make charitable donations, this type of thing. If you're dealing with that type of philanthropy in your community, foundation, large or small, there are some strategies, I think, to move them along. And of course, please connect them with me. I'd be happy to talk with one of their program officers. But foundations kind of have a range, if you think of a bit of a scale. Some are very donor centric and some become very proactive. And, historically, conversion foundations exploded in the 90s. And these old hospital boards were very focused on that individual level change because they were treating patients. Today, those boards have cycled through. You're seeing staff come in that are not just the hospital staff that moved over with those type of health conversion foundations. And you're seeing the formation of new foundations that are more likely to be involved in systemic change. And that's going to be really important because they're more likely, I think, to move with you and encourage that type of change. Foundation priorities because of this election. I don't know, but so some of the stuff I'm going to tell you, I think would be important, for me at least, regardless of who's winning or who's losing. I mean, things change in our nation and we need to be prepared. But due to this disruption, I do think that emergency food is going to be out there quite a bit. And more than just how do we fund it, but real questions about what are we doing here? Isn't there a better way? And I think that's going to ring true for K through 12 education as well as higher education. I think childcare, we're going to ask, is there a better way? And not just to get more money for the model, but how to change the model. I think homelessness I don't think it's as big as the others. I hear less about it, but I think how we care and treat homeless people needs to change. The virtual care of medicine. I think foundations are going to be really ripe for those areas. I do think emergency readiness in our cities and counties need to change. Right now, I see a lot of fire, office emergency management, people who are trained for crisis that have kind of a known arc to it. Hurricanes, these types of things. We've been less ready for an ongoing crisis. I don't know how foundations are going to really be there. One way our foundation is we're placing staff and sometimes even relating some of our board members to local groups and committees to kind of give input and figure out where we can fund that change. Mental health's not going away in the future. That model is changing. We need more of that, in my opinion. And I don't think some emphasis on chronic diseases, diabetes, obesity is going away. And of course, we can name other things. So really, that point is philanthropy, I think, has a role, Bob, in where we go.
Yeah. You just mentioned mental health, and as we speak, Dave Phelan was just elected Speaker of the House, right? Our Speaker, and he's very focused on mental health, and so it'll be interesting to see that dynamic. I want to go to Chris Wallace. Chris, you're at the North Texas Commission. You used to be at the Texas Association of Business. You know business inside and out. You know the advocacy world of business. Traditionally, when we think about businesses across the United States, it's all about tax cuts and economic development. But in a state like Texas, we have seen the business community maybe be a little bit more activist in terms of sort of that bigger picture, understanding that education is part of economic development and childcare. How does the recent election impact or help or sort of drive the way business sees its role?
Thank you, Dr. Bob. And I too want to express my appreciation for your leadership and all the great work that Children at Risk does across our great state for children and families. Business will continue to be engaged. As Susan referenced, for the past, 30 years, we've seen more heavy engagement by business. I think it's really three components. One is we're seeing more civically minded corporate leaders. I think shareholders are expecting that. Two, I think employees are expecting that. Employees are expecting, if you look at some recent surveys, BIPAC and others, the most influential entity that individuals have in terms of political leverage, in terms of who to vote for, looking at voting records, it's not necessarily the media, it's not church, it's not a neighborhood association, oftentimes it's the employer. And so that's why we and others across the state and across the country are implementing these employer to employee tools, E2E tools, to encourage employers to have their employees get out and vote, give them all the tools they need in terms of how legislators voted on issues within their industry, their business, their jobs, to all the basic information that they need. And that's why I think we saw a huge historic record turnout, which we all should be celebrating today in the next coming weeks, this historical voter engagement. But the most pressing issue that businesses see is workforce pipeline. That is our, as you know, our biggest challenge in our state is our workforce pipeline. Here in our region, it's workforce pipeline, infrastructure, and housing attainability. Those are our top three challenges. Outside of long-term recovery for COVID now, that's got to be had to be eyes focused on that in the 87th session. So I think you're going to see businesses continue to engage. Despite any election results, businesses must continue to be at the table, particularly here in Texas. We're low regulatory, we're a business-friendly state. We're going to continue to be that way, and businesses play a huge part in it. We've seen example after example in the last several sessions, whether like Bob mentioned Bob Garrett in the last panel, which I love that last panel, by the way, loved it. And Bob Garrett mentioned, with the bathroom bill, we at TAB and others, we fought hard against that. And we had businesses, of course, we had Speaker Strauss with us, which was huge leader to fight against that issue. But businesses were there with us. Business leaders were engaging. And I think we're still going to see, because of our healthcare and the pandemic crisis that we're in, we're going to see Medicaid expansion be an issue in the next session. At least it will be discussed. And we've seen some prominent Republicans across the state say in the last couple of weeks that issue needs to be discussed. One, we need the revenue, but two, we've got to make sure that those million+ Texans are insured. So that being said, I think you're going to see businesses continue to weigh in on healthcare, on immigration, like we have been in the last several years, and most importantly, education and workforce development. We have to make sure that we sustain HB3. And if you look at our 41 House members and 9 senators, the 50 legislators that we work with in our 13 county region, across the board, it is HB3 has to be the top priority right next to COVID-19 recovery, long-term recovery.
Yeah, very good. We have a shortened panel, but I'll ask one final big question. Susan, we've all mentioned this, a great turnout yesterday, right? People want to be engaged. How does that engagement, also the fact that Texas, and Susan, and I have talked about this, Texas is still conservative, whether it's more Democrat or Republican, it's still a pretty conservative state. So we maintained that conservatism yesterday, but we had all this engagement. We still have lots of people moving into our state. They're going to continue to change things. Our Latino community is still growing. What does all of this mean for us as we move forward, and for your work as we move forward in the next 10 years, maybe even?
Well, it means that we have to all be really cognizant of change. You know, one of the things that struck me last night, watching one of the many news shows, was looking at how fast they were talking about how fast Arizona was changing, and saying, you know, in a blink of an eye, practically, what the commentator was saying. And it made me think about Texas too. So, you know, pay attention. Chris hit the nail on the head. Businesses still want to come to Texas because it's a business friendly state, but businesses also know how important it is to maintain a workforce pipeline. So pay attention to that, engage with our corporations around that, and also know how important it is to businesses to engage their employees, particularly their young employees, which are going to be the main part of the workforce, you know, already are, and certainly will be within the next 5 to 10 years. So how do we make a state in which, you know, it's rapidly changing, businesses want to come here, but they see the critical importance of investing in the long-term success of the state from the very early years, and they know how important it is to engage their employees as part of a state. So I think those are all key things that we just have to pay attention to. We can't operate in a silo of here's government, here's business, here's philanthropy. We are definitely all in this together, and I would say that that's the biggest takeaway, I would say, for me.
Michael, when you see all this engagement, all this change happening in Texas, what is it meaning for your line of work and for philanthropies across the state?
Yeah, philanthropy, you know, historically it was involved with policy. It moved to a long period of time where it wasn't, for various reasons. And now the pendulum is swinging a little bit. So I think philanthropy is ready to do more advocacy in general. You know, just like many nonprofits, philanthropy looks at itself and says, we've got to keep our operations costs low. So when a nonprofit or community organization approaches a philanthropy with a great idea that doesn't kind of stress the philanthropy a lot, I think they'll take to it. So I mean, some approaches I would recommend out there is realize needs, not a strategy. You've got to have something ready for change and improvement. Use these words, general purpose grant. Ask for that. And if your program officer doesn't know what it is, y'all find out what that is. You want those. Consider coalition work or work groups with work plans versus, would you please fund my organization? It kind of goes to this, let's all come together, with whether it's businesses in there and the like. That really creates some strength, especially if the coalition isn't designed just to seek money. Foundations, while we most can't lobby, we can conduct nonpartisan research and dissemination plans. So if you have an idea of partnering with businesses, universities, other nonprofits, government, to kind of collect data and then disseminate that information for a population related to a topic of change, that is a great first step that can be funded. I think you can be creative in associated messages and services. So if you're working on, for example, education change, you know, ask a philanthropy, would you fund some scholarships? Because like when we give this scholarship away, we get in the newspaper, we get a lot of earned media, and I can talk about why this was important, or this pipeline to work, or this trade or whatever was important. And you can do that with food pantries and lots of other kind of services. You can do capacity building for your own organization and staff, I think. And remember that if you have a connection to a legislative body, a foundation can speak in front of a legislative body if invited. So if your local foundations have, for example, board members who are well connected politically, if they can get invited, they can say powerful things there, I think. And then finally, what I'd say is you can advance some broad social ideas. And we just heard about internet earlier. So I think one broad social idea is internet more like a utility, or is it more like a public good, like a road that we all use? And start framing some of these broad social ideas. So lots of ways to work with philanthropy, and I think they're ready for change.
Very good. Chris, you get our final word. You know, all this engagement, all this change, what is it meaning for us in Texas?
Yeah, you know, I want to give you, Dr. Bob, I want to give you just one quick example of the importance of the philanthropic community, just to follow up on that last question. You know, not only are we seeing the importance of our philanthropy friends in COVID response, but just this census that we just completed. It was not the state government that was leading the census for Texas. It was the philanthropic community. It was the business community joined together. It was locals, elected officials and others joining together to make that work. And that's why we ultimately achieved a really good outcome in terms of a really good response rate. And so hats off to my fellow panelists, because it was all of us coming together, including children at risk, to make sure that every person was counted. So, you know, the business community has to continue to engage. Yeah, my Chamber of Commerce partners across our region and across the state are going to ensure it. We have a regional chamber coalition. I'll just give you one more quick example.
Yeah.
There were 102 chambers of commerce within our 13 county region. 9 of them have Jason's own staff. They have great lobbyists on staff, including our association. So there's 10 of us. And we have all divide and conquer, and we are managing the top 10 issues voted on by all the chambers across the region. What's really cool about it too is we just, with our mayor's council, these are mayors all across our entire region, they all just signed, about 40 of them signed a support letter for those top 10 issues. And you know what's number 1 on that list is HB3 sustainability. Number 1. So you had mayors, you had private sector, public sector, chambers of commerce, all coming together across our region to let our 50 legislators know that HB3 has to be number 1 on the list. And so that says a lot right there of all sectors working together to make sure that our workforce pipeline is successful in the future.
It is interesting, right, that we've heard this time and time again, how Texas is so good at attracting people from out of state, but we haven't done as good a job of taking care of our own, which is exactly what HB3 is about, is creating that our own economic lifeline so that we have our own kids become a big part of our economy. Susan Hoff, Chris Wallace, Michael Kelly, thank you guys very much for all that you do. And thank you for being a great part of this panel and a great part of this day. Thank you so much. And keep your eyes on those returns. We'll see what happens, right? So it should be interesting. Thanks, guys. Let's move to Jason Sabo. Michael Kelly calls Jason Sabo sort of a walking TED Talk. And so I love this idea. So Jason, you have, I think you have 9 minutes to give us, what do the elections mean for Texas children? And so we have a 9-minute TED Talk. Take it away, Jason.
Awesome. So what I want to focus on at the very end here is we've heard a lot of information. Things have actually become a little bit clearer even while these last panels were happening. At noon today, so in 11 minutes, if you want to, at the end of this, on your dial, turn over to the House Speaker's press conference room, and there will be an announcement being made by a guy named Chairman Dade Phelan, the current Republican chair of the House State Affairs Committee from Beaumont. You may have seen the guy on the news during various hurricanes that have come through. You probably definitely saw photographs that he was taking of I-10 as a lake, which I think made international news. big, as Bob said, supporter of disaster preparedness, mental health, kids. And, we were saying earlier, probably we're going to see something in the Strauss mode. I think that's what we're about to see happen, a new speaker that very much is in that kind of Joe Strauss mode. So what I want to talk about for the remaining 8 minutes is, okay, where do we go now? We know what the election results are more or less, and we know, make sure that things have changed dramatically. And, I'm inspired by all of this because I have a personal reason to be inspired. That's my kid. And this was the first presidential election that he got to vote in. So this is an important moment for all of us. And we cannot lose sight of the inspiration in all of it. But we also can't lose sight of the fact that we have to get to work. Because believe it or not, next Monday, the Texas legislature will start pre-filing legislation. So believe it or not, 5 days from now, the game is on in a very real and earnest way. We don't know what this session is going to look like, but we do know that it's going to start on January the 12th. The Texas legislature is constitutionally obligated to do one thing and one thing only, which is pass a budget. So between January 12th and May 31st, the only thing the legislature has to do amidst a pandemic is pass that budget. We really still don't know what things are going to look like in terms of access to the building. So the session will end on May 31st. There'll be the 3-week veto period where the governor has his chance to thumbs up or thumbs down, or just kind of ignore and let them become law, all the bills that the legislature has passed. Now, under normal circumstances, as we've talked about with redistricting, there would be a redistricting conversation happening during this session. However, because of COVID, all of that has gotten pushed off until the state gets the data from the Commerce Department, the Census Bureau, about how to redraw those maps. And we now know that that data won't be coming in until the end of July. So that means that, as Lieutenant Governor Dan Patrick has said more than once in public, don't make vacation plans before the end of September. But if you look at the calendar here, September 14th is the beginning of candidate filing for the 2022 elections, and March 1st, 2022, which is not that far away, is the primary election, which we know in Texas is in many ways the de facto general election, especially given what we've seen over the course of the last day or so. I think that trend is going to continue. So all of that to say, get ready, November 8th, 2022. Well, I'm sure you're excited to hear, be happy, be here before you know it. Now, let's talk specifically about how advocates can be effective over the course of this next, 8, 9, 10 month period. Now, if I'd asked anybody on this call a year ago, 1 year ago from today, if I'd said to you, in 1 year, you were going to be proficient in multiple different programs of video conferencing. You will be an expert in Zoom. You will be an expert in Microsoft Meeting. You'll be an expert in Google Meet. You'll be an expert in all these different programs that a year ago you did not know existed, because none of us did. However, now, because you're listening to me talk at you, you're very proficient in all of this stuff. So if you think that you cannot get prepared technologically for the challenges to come in the upcoming legislative session, you're wrong. You can, you have. Now, let's talk about what advocacy is going to look like. I live here in Austin and I ride my bike a lot. I like to ride my bike around the Capitol and kind of check out what's going on. It has been locked down tight, the entire Capitol grounds, since May. The building itself has been shut to the public since March. The question becomes to all of us, if everything is different about how the Texas legislature functions, how do you as an advocate still become effective and efficient in a pandemic controlled legislative session? Number one, mobilize the grassroots. There are people on this call from every community in Texas. If you've never reached out and mobilized people around the legislative session, this is the time. And I say that because the members themselves are going to have less access to the Capitol as well. which means that they're going to be home more. The legislative session might meet for 2 weeks and then take 2 weeks off. More of this session will be conducted remotely, virtually, and from the district than ever before. That presents a real opportunity for local activism and advocacy that never existed before. Number two, all of us are obsessed with email and all of this, building lists. Now's the time to build your list, clean your list, and make sure that when the legislative session starts in earnest, you're not having to play catch up. Figure out who you need to have on your contact lists and get that done now before the session even starts. Another thing to be mindful of, we have allowed ourselves to become political communicators in tweets with little funny videos from a Seinfeld episode that happened 15 years ago. We got to do better with our communication style. We got to up the game. We got to up the intellectualism of what we're asked to produce now, because if you cannot go and provide oral testimony, if you cannot go from office to office and negotiate the nuances of your idea and explain it to people over and over and over again in person, which we all know is the most effective way to get this work done. If you can't do that in person, your documents, your written word better be good. Because remember, you're not going to have a big advocacy day at the Capitol. There won't be a big day where you all go en masse to the building. They don't want you there because they want you there in small groups. We got to begin to think about how we're going to negotiate, what our bills look like in a process where we cannot physically take a piece of paper around and have that kind of negotiation. No one is better prepared for the challenges presented by the pandemic to advocacy than child advocates in Texas. The red carpet has never been rolled out in front of us as we go to the legislature. We've always had to find our way in that wasn't necessarily the front door. It might have been the back door, it might have been a window, it might have required a ladder or a grappling hook, but we've always gotten in, we've always made our point, we've always moved the agenda in a positive way for children. Nothing will change that. We will continue to win and we will continue to fight on behalf of kids because now more than ever we have to. It doesn't matter about party, it doesn't matter about politics, it matters about our kids. Let's get to work.
Jason, nice TED Talk. Very good. Thank you so much, Jason. As we finish up today, I want to thank all of our participants for being here. We hope that it was a useful day for you today. We have a survey, I think, for you guys to do to sort of let us know how we did. And Mandi, are you still available? Can you come on? Would that be, do you have a second to come on? I don't know if you're available or not. If not, there you go. Mandi, I thought, did you have some sort of reaction to all of our great speakers today?
Well, I'm extremely grateful to our great speakers today. And what I'm excited about is that we have diverse voices geographically and through different sectors. And with our eye on the prize, I think that we can be successful moving forward. And so I look forward to working with everyone who spoke today and who participated as well.
Yeah, I love Jason's message. I loved our panels. And thank you very much for that agenda. Listen, everyone, take care, stay safe. Let's keep our eyes on the news, see what happens for children. Take care. All right. Good night. Goodbye, everyone.